Are you facing some symptoms that are quite honestly nagging or annoying? Or maybe you have some persistent pain, but you've been to the doctor many times and you just can't find out what is wrong with you. Well, my guest today is an expert on that very topic. She's Dr. Julia Bowlin, and she has an interesting twist on medicine. Hi, Dr. Bowlin. Thanks for being here with us.
Thank you. Pleasure.
So, you've seen thousands of patients in your private practice. What happens when a patient comes in and you just can't find anything wrong with them?
Well, so many times I have patients that have been through doctor after doctor or even seeing me for years, and they have all the tools that they need, they have the education. I've seen them go from one symptom to another, and yet for some reason, despite the education and the knowledge, they just don't seem to be able to bust through that barrier and either lose weight or eat better or exercise more.
So you have an interesting twist on medicine in general.
I do. After seeing so many thousands of patients run into the same problem over and over and over again, I realized that I think maybe it's time to recognize that it's not the pill that's the answer, that maybe it's a prescription for personal awareness.
You know, that's interesting because I think in the society that we live in, we go to the doctor, we want a prescription. We want them to give us a pill or a medication that we take for 7 days, 10 days, and everything is better.
Yeah, absolutely. You know, when you start to understand who you are and what makes you tick, it's interesting how your perception of your world goes. Have you ever been on a trip in a town, let's say, and it's a brand new place and you've never been before, and you're walking in and you don't know which way to go, left or right, and it's kind of scary, it's a little unfamiliar, but you're not sure what to do, and then you're thrown a detour, and all of a sudden you're already lost, but now you're really lost? Sometimes it's like that with our own personal awareness. We run into stumbling blocks or detours or traffic circles that keep bringing back into the same patterns of behavior and thoughts, but we can't recognize them. So when you understand your own inner terrain or your own territory inside yourself, it's interesting how it's much more familiar, you're more relaxed, you respond better, and guess what? You can step over that puddle instead of drowning in it.
So I understand when you work with your patients, you don't just look at what's going on with them physically, you also have a much deeper approach. What other things do you take into consideration?
I look at their environment. I do environmental analysis. I think about allergies. I think about more than just what they do when they wake up in the morning and their symptoms. Symptoms in general, they're, pain and sadness and depression. But when you break it down, what are they doing when they walk out of bed? Are they drinking coffee and eating ibuprofen all day long? Are they putting 16 different chemicals on their face before they even brush their teeth? Are they driving in cars that have exhaust that's backfiring? It's more than just symptoms in this world. It's about knowing your environmental, physical, and spiritual health.
So we may not be able to go into all 8 steps, but what if somebody was watching and they wanted to get started, what would be maybe the first step?
The first step? Well, I would say learning to flirt with yourself. Knowing what makes you excited, knowing what makes you feel good, knowing what makes you feel colorful and vibrant.
So Dr. Bowlin, I understand that you're also a best-selling author. Tell me a little bit about your book.
I am. Krista and I wrote a book, To Me I Thee Wed. Learn how to love, honor, and cherish yourself forever.
That's an interesting title. What does that mean, To Thee I Wed?
To Thee I Wed? Well, it's interesting. We spend so much time in our lives looking for another person, another spouse, another education, another school to try to help fulfill certain aspects of ourselves that just seem to be lacking. So many times, however, if we can become more personal aware of who we are, it's interesting how we can learn how to love, honor, and cherish ourselves.
So I understand there's a lot of personal content in here about yourself and your own story. Would you share a little bit of that with us?
There is. As a teenager, I really struggled a great deal with depression, severe eating disorders, and a lot of self-harmful behavior. And I knew what it felt like to be divorced from myself. And I knew at the age of 18, after having a certain horrible situation occur, that there's a reason for this. And I knew I was going to write a book, and now's the time.
So what do you think goes on with people if they are not in love with themselves, if they're not married to themselves, using the language in their book? What does their life look like?
They struggle with disease or disease. If we're not aware of our discomforts and we're not aware of our self-sabotaging behavior, or even worse, aware of our own self-neglect, disease occurs, difficulties in relationships, illness, maybe even difficulties with your life in general, such as work and employment.
Now, would it be a leap to say, as a doctor, that sometimes when you see people with symptoms and illnesses, it actually has something to do with their ability to care for and love themselves?
Oh, not at all, not at all. I'd have to say probably, I believe the statistics is 90% or higher.
Dr. Bowlin, is there a link between self-love and our physical health and wellness?
Absolutely. There's a very large statistic that states that the number of people that come to see a physician actually have an emotional issue more so than a physical issue. And that emotional issue is many, many times directly connected to a level of self-care, self-love.
Now, can an emotional issue cause physical pain?
Absolutely, absolutely. It's been documented that emotional issues increase asthma exacerbations, ulcers, heart attacks.
So, inside your book, you lay out a program, a system, if you have it. So if somebody's suspecting that they may have some emotional issues that are a link to their physical pain, where do they start to break that apart?
Well, I think first of all, recognizing that maybe they have some stumbling blocks that they need to address. And once you've recognized that you have the stumbling blocks, realizing maybe the next step is to get some help. And maybe that help is finding a system such as mine.
So tell me a little bit more about your system.
Well, my system is an 8-step process whereby I help you navigate who you are, what you think, what your fantasies versus fictions are. I take it one step even further in that I use sort of the same process that we use when we're finding a spouse, where we meet and we greet and we flirt and fall in love and get engaged, but I apply it to yourself. I teach you how to find what makes you excited, what makes you entertaining, what makes you fun, and what makes you feel good and excited. I teach you how to be more engaged in yourself. And so these steps are as old as time, but they're unique in that I apply them to yourself as an individual.
So talk to me about your practice. You're a physician, and recently we were talking that you felt a real challenge trying to put people in different categories. What's going on?
Well, the change and the transformation of American medicine is startling these days. Everybody's pretty much aware of that. But as a physician, from my experience, I'm finding it very difficult to help people fit into templates when they walk into my office. The electronic medical records, they're templates. And not everybody fits into a template. And I find that very difficult in that when I care for a person, I need to personalize them. I need to find out what makes them tick, not fit them in a template.
Dr. Bowlin, Julia, for someone who is wanting to get started right now, obviously they may not be able to make it to your personal practice, what's one step that they could take even in this moment, while they're watching this program, to just feel more vitality, to feel better, to maybe end some pain in their lives?
One step, make the first step. That's what most people don't do. They know they should make that step, but it's maybe as simple as sitting down and putting a pair of tennis shoes on. Trust in oneself is an easily lost trait. If you had a friend that you're supposed to meet every Monday for lunch and they don't show up, are you going to trust them? If you promise yourself, tomorrow I'm going to exercise, tomorrow I'm going to eat better, but you don't do it, are you going to trust yourself? So make a very small step, one little thing, even if it means putting on your tennis shoes every day at noon. Build that trust up slowly but surely.
Dr. Julia Bowlin, thank you so much for being a guest here with us, and good luck with everything.
Thank you.